Hi, good afternoon, everyone. Wherever you are, thank you for joining me here today. And thank you to Lupus LA for the opportunity to come in and speak. So my presentation is going to be titled Occupational Therapy's Role with Lupus. And my name is Madelyn Cabrera. Okay, so just a little background about myself. I'm an occupational therapy doctoral student, and I'm currently in my 8th term, so the final part of my program. And I am actually working on a capstone focusing on raising awareness on occupational therapy's role with lupus patients. So I wanted to share more information about our field with the lupus community and also beyond for those who are probably curious. I'm also mentored by Dr. Christine Carndong, and she is also a licensed occupational therapist and has done immense research with the rheumatic population. So a little background as well, I was drawn to working with the lupus community because one of my close relatives was actually diagnosed at her early 20s, and young adulthood in itself is already difficult to manage. So I saw how having an autoimmune condition such as lupus took a huge toll and created major changes in everyday life. And whether it's managing medication, managing symptoms, mental health, physical health, I saw that it was a lot to handle. So as I started my journey through my occupational therapy program, I learned that we specialize in helping patients in their everyday life. And I thought we should talk more about it and how we can work with the lupus community. And it really made me passionate about learning how to be more of an advocate for this community. So just going over our presentation today, I will be defining 3 major points, which is defining what occupational therapy is and how it works. And many people have heard of OT and some haven't, or some may not be aware exactly what we do. So that's something I want to talk a little bit more about and describe who we are. The next point I wanted to go over is what is occupational therapy's role with lupus patients and what exactly does that look like? So I will be going over different areas on things that we work on when coming up with treatment plans with lupus patients. And lastly, I wanted to give examples of what it looks like when working with patients and also provide tips if you're interested in talking to your provider about getting OT services. So what is occupational therapy? Occupational therapy is a healthcare profession with the main goal of promoting health and well-being and also independence in daily living. So we focus a lot on helping you do things that you want or need to do every day, whether it's something as simple as making breakfast or being able to play catch outside, or managing symptoms of a condition that you have, or adapting to a recent injury. So we focus on helping you continue to do things that are meaningful to you despite those setbacks that you face or any barriers that you encounter. And by doing so, we understand that each individual is different in many aspects. As we all know, lupus patients are not one and the same, so it is important that we understand different areas such as your specific wants, your specific needs, your background, and limitations when moving forward, and for us to come up and creating a treatment plan. So what exactly can OTs do for you? These are some areas that OTs can focus on, but they include and are not limited to activities of daily living. So these are your basic self-care tasks in the day. So something like brushing your teeth, making your bed, and making breakfast for yourself. So basic self-care tasks that one has to do each day. We also work a lot with health management, so helping you manage your medication, organize your doctor's appointment, access resources that are necessary for you. We also want to help in maintaining your employment and keeping your job and staying in school. So despite any barriers that you encounter, anything new life changes, we want to help you seek the accommodations or provide recommendations so that you keep doing the things you want or need to do. We also want to help you stay doing things that you enjoy, whether that's going outside, playing soccer, painting, those types of things. So we try to find ways to help modify a task or provide, again, recommendations to help you keep doing those things that you love to do. We also provide assistance in family and caregiver training. So we can provide recommendations and different strategies that you can use in case you need some assistance in handling childcare or delegating tasks to a caregiver, especially with major changes that come with a chronic condition. We also focus a lot on home safety, fall prevention, and accessibility. So this is very important, especially when patients are coming out of the hospital or transitioning back to home. We like to assess if your home is safe to come back to, and that we get rid of any hazardous areas, and we want to make sure that it's accessible for you through any recommendations or modifying the environment. So what makes the OT perspective unique is that we understand the individual, their environment, their meaningful occupations, and how they all play a role in health and well-being. So we take a holistic approach and understand that a person is different from one another and that we see them as a whole when coming up with a treatment plan. So what does OT's role with lupus look like? OTs help doing meaningful and purposeful activities, and we understand the complex and dynamic interactions between the person, their environment, and their occupations. So for this slide, I will be going over different areas that we can work with when working with patients diagnosed with lupus. So this also includes, but is not limited to, symptom management. So we work on understanding your symptoms and understanding your needs, both physically and mentally. We understand that a chronic or autoimmune condition like lupus is difficult in itself. So understanding lupus can vary in symptoms, and we all know that there can be flares and uncertainty, so an increase in symptoms. So we try to work on ways to help manage that too. We also can provide recommendations in areas such as managing medication, doctor's visits, finding support that you need in order to help your health and wellness. OTs can also specialize in physical agent modalities. So that's a big word, but basically we can use thermal heat to help you with pain, increase blood flow, and decrease inflammation. So a lot of occupational therapists work in a hand therapy setting. And this is just an example of paraffin wax, which is another physical agent modality. We can also provide education on energy conservation and fatigue management. So fatigue is a very common symptom with lupus and can impact the ability to do things that are important to you and meaningful for you. So OTs can provide strategies to help conserve your energy and allow it to fit into your everyday life. One tip that we have is the 4 Ps, which stand for prioritize, plan, pace, and position. So what this can look like is prioritizing important tasks first in the day and beginning with stuff that needs to get done first when you have a lot on your plate. We can also recommend having proper body positioning, just like how it looks like in the diagram. Instead of bending your back, try to sit upright when picking up things or sitting in front of the computer, as sitting upright can allow for more oxygen to enter your lungs. So just small things like that. We can also recommend pacing yourself and taking small breaks when doing activities and not rushing, or even planning out your day, or week ahead of time, making sure that your schedule allows for a good night's sleep, or possibly spread out activities throughout the week for balance. We can even help with just planning to get things together and prepared before doing things like cooking or about to take a shower or washing your dog. So these small little things that can help conserve your energy throughout the day. We also work a lot with joint protection. Joint pain and inflammation is another symptom of lupus that's really common. And as OTs, we can help provide you with tips on protecting your joints, whether it's avoiding using tight grips or holding large and heavy objects, just like the example. Try to hold it with larger joints or having it close to your body. So just like how it looks in the middle diagram, try to hold it with your elbows and wrists rather than just your hands to reduce any stress it causes in the joints. OTs also work a lot with stress management, and I probably don't have to explain this. Living with lupus is stressful on its own, and sometimes stress can trigger symptoms. So OTs can, again, look at your lifestyle, your support system, your job, your physical and mental health, and work with you to come up with different coping strategies to manage your stress, whether that be relaxing techniques such as breathing or channeling your thoughts within a journal, or just encouraging support from others in your life. We also provide recommendations on adapting or simplifying tasks in your everyday life and also your environment. So we take a look at your environment and provide recommendations to help you perform better and more comfortably. This can be done in any setting that you complete your your everyday tasks or your meaningful occupations, whether that is a work from home setup, or just making sure your home environment is safe by avoiding any fall risk. We can also provide any tips on adaptive equipment that can help you do things with ease, and provide resources to purchase them through affordable websites, whether that be something as simple as a thick foam tube to replace the grip of an everyday object when you're experiencing joint pain, or something like a reacher that can help you pick up objects from the floor to help you conserve energy. We also work closely with integrating medical recommendations through your daily routines. So lupus can consist of a lot of symptoms that we haven't talked about previously, including skin or sun sensitivity, headaches, skin or mouth sores, and we can work with you to provide ways to manage symptoms in order to do things that you enjoy, such as recommending proper clothing, especially with summer and when going outside, using sun protection, helping with bandaging when necessary, or just overall help you become prepared when you're experiencing these symptoms. We also work closely with physical activity and helping integrate physical activity into your daily life and routine. So physical activity, as we all know, is very beneficial to our overall health and can help a lot with strengthening different parts of your body, such as your heart, your lungs, your bones. So as occupational therapists, we can gauge what forms of physical activity are you ready for, what is appropriate for your lifestyle, and how to integrate that into your day-to-day life. OTs also provide recommendations to different splints or orthotics that can help protect, mobilize, or support your joints in order to help you do things that you need to do with ease, which can be really useful when experiencing joint pain. That was a lot of information. So if you see yourself in any of these activities, here are some tips on getting OT services if you are interested. So these are some personal tips that I put up together. So keeping track of your symptoms when you can, whether that's writing it on a journal or keeping it in your notes app, writing the dates, that would be really helpful whenever you're going to see your doctor, because of course, seeing your doctor doesn't happen too often, and we often have to wait. So having that prepared would be really good. You can also share how your symptoms impact your daily life and your ability to do things that you want or need to do. And also ask your provider more about OT services to determine if it's the right fit for you as well. So that concludes my presentation. Thank you so much to Lupus LA for having me. It was a lot of information. So if you have any additional questions or would like to reach out to me, please contact me through my email or message Lupus LA.
Thank you so much, Madelyn.
Thank you.